What were your symptoms before the surgery and how long did you have them?
Oh, it started about probably 6 years ago, and it gradually got worse. And towards the last, I couldn't walk more than 100 feet probably without it killing me, and I couldn't stand more than 5 minutes, and I couldn't sit in this hard, straight chair.
Yeah.
Life was just miserable.
Yeah, 1 to 10, how bad was the pain?
Oh, 8, 9.
8, 9.
It was bad.
Your symptoms, we have a name for that. We call it claudication, meaning that when you start doing things, especially walking or standing, it push more on the spinal cord because there's a narrowing there. We call it stenosis. And that sort of push on the nerve, and that people have symptoms exactly like you described. And you had it for 6 years, right?
I'm guessing, at least that much. I'm guessing at least that.
But you have done all the other non-surgical treatment already, and none of that really helped.
Yeah, a couple of different times I had the shots, the injections in the back, and physical therapy, and
none of that was helping.
And I didn't want to think about having the major surgery the way they used to do it, because I talked to people that had it done.
What did they tell you? Those regular open old-fashioned surgery?
Yeah, well, we had a neighbor lady that lived just across the road that had basically the same surgery done, and she was in surgery for 6 hours, she was in recovery for 7 hours, and she was in the hospital for a week. And
how was your surgery? When was it, by the way? When was your surgery?
The 27th of May.
You don't remember, but your surgery was 45 minutes, and we lost a spoon of blood, about less than an ounce of blood. Yeah. And how long did you stay in the hospital?
Just overnight, and I was walking that same evening.
Same evening, yeah. And how's the pain?
Virtually gone.
Virtually gone.
It's such an improvement that I would recommend it to anybody.
Yeah, and here it is. We did actually here, we did 2 spacers. We did 6 screws, and we sort of jacked it up. By jacking it up, we opened up the space. So we treated the stenosis or narrowing without cutting bone and the muscle, and that is why you're recovering so much faster. Yeah. Because we didn't do any cutting of the bone and the muscle that your body has to recover from.
Yeah, no, I'm well pleased. I'd recommend it to anybody.
Now, are you still taking any pain medication? Some?
Just Tylenol.
Just Tylenol.
Yeah, and I haven't been taking oxycodone for the first week and a half was a little rougher, but I expected that.
Yeah.
But then when it started feeling better, it progressed rapidly.
Yeah, well, that is, obviously you will feel that we did something inside of you. We have evidence of that on the monitor. Yeah. But overall, I'm very pleased, and your surgery just, we could correct the situation in a 45-minute procedure with a spoon of blood, and you stay 1 night hospital stay.
Unbelievable.
Unbelievable. And it's almost unheard of having this kind of result with open old-fashioned surgery.
Yeah.
And believe it or not, there's only a very small fraction of the surgeries of this kind are performed this way. Yeah. And most of the people are still getting the surgery your neighbor got.
Yeah. And one thing that I was leery of having any kind of back surgery, because I was afraid of the outcome. If I'd end up in a wheelchair or worse, Had this been out 6 years ago and I knew it was going to be this good, I'd have done it then. No, well, I'm well happy. I'm well satisfied with it.
Thank you. I appreciate that. But thank you so much for the interview. I appreciate that.